Hi, my name's Alif Musaji. I'm the principal dentist at Oakdale Dental, but you know me as the Smiling Dentist. Today, we're going to talk about colour in dentistry. Colour in dentistry is a really important topic. Getting the character, the shade, the way that the light interacts with teeth, getting all of that right in our restorations is such an important secret in order to give us that beautiful moment when we fit the restoration into the patient's mouth and it just disappears into the smile. Let's face it, when that happens, that's a good day all round. So I want to teach you some of the distinctions that you might need to understand about colour so that it helps you in order to provide these restorations for your patients. So first we need an appreciation of colour in physics as a topic. And when we talk about colour, there are three distinct elements. The first one is what we call the hue, the second is the chroma, and the third one is the value. So the hue is the color, like the prevailing shade. Is it a blue? Is it a green? Is it a red? And the chroma is the concentration of the color. So for example, if you had a glass of water and you poured one drop of Ribena into it, then it would be very dilute. The chroma would be very low. And as you add more and more Ribena into it, it would become stronger and stronger and stronger, and the chroma would increase. Now, in dentistry, because there aren't that many different hues, teeth are pretty much tooth-colored, and they have that color, that kind of creamy yellowy color, because they get their color from the blood that's in the pulp and the dentine prevailing color, which is sort of a creamy yellow. Now, because there is only one hue, in dentistry, we've kind of lumped hue and chroma together, and the term chromaticity is what's used. And we'll talk a little bit about where chromaticity comes from in the anatomy of the tooth in a second. So the other element, as I mentioned, was value. Now, value is the brightness in the tooth. So if you imagine you had a photograph and you desaturated it, i.e. you took all the color out of it, you'd end up with a black and white photo with blacks, whites, and all the shades of gray in between. And where we're going from white to black is where the value is dropping. Okay, so it's getting darker and darker and darker. So back to a tooth again, what we know is that the chromaticity comes from the dentine within the tooth, and value comes from the enamel. So if we think a little bit about the different parts of the tooth, i.e. the gingival and the incisal end, we can work out which bits of the color are most important. So we know that at the gingival end, the enamel is very thin, and so you see more of the dentine through that tooth. And so the chromaticity is most important at the gingival end. We know that at the incisal or the occlusal end though, then what we end up having there is the enamel from the buccal side meets with the enamel from either the occlusal or the incisal surface. And where that enamel meets together, we're seeing enamel only, so it's the value that's most important there. And in the middle bit, you find that there is a bit where it's a bit of both. And this is really important when we are shade mapping for restorations that we're delivering for our patients, or if we're planning composite bonding or anything like this, because it helps us to understand that there is this natural gradation throughout the tooth, and it helps us to mimic that in the restorations we provide. One more distinction is that over time we notice that enamel will get thinner. So we generally have higher value in younger teeth. And as people get older and as teeth wear down over time, we'll find that value will naturally drop. And one point as well to make is about tooth whitening, because whitening, the brightness and the improvement in the brightness that our patients experience is really a function of the effect of the whitening gel on the enamel. So we must be very open and honest with our patients that the improvement in shade that an older patient might get might not be as impressive as the change that a younger patient might have. So I hope you've enjoyed our little potted history into colour in dentistry, and I hope that those few little distinctions will help you to understand more, see more, and provide better restorations for your patients. Now remember, it don't matter if you're black or white. Like, subscribe and share. And I hope to see you again for the next video.